Hi, I'm Dr. Nancy Halsema. Welcome to our office. If you're viewing this video today, you're probably anticipating becoming a new patient in our practice. We have a lot of questions about what happens at that first visit, so I thought maybe I'd share a few things with you today so it'll be a little bit more familiar for you. If you're coming in with a specific concern, a toothache or that sort of thing, obviously we would address that as our very first appointment with you. But if you're just planning on being a regular patient in our practice and just want to be established with us, we have a special appointment that we call our initial exam. So I'm going to share just a few things that would happen at that appointment. The first thing we want to do is just really get to know you, know what your concerns are, see what your goals are as far as your dental health. So there are several questions that we'll go over as to what you're wanting to accomplish with your teeth. If you have some areas that are sensitive, that sort of thing, we want to be aware of all of that. So we'll go over all of your dental concerns. We will also review your medical history, check with the medications that you're taking, make sure that they don't have any implications as far as your dental health, just review all of that. Those forms are available online that you can download them and fill them out ahead of time, or we'll be happy to send copies of them in the mail to you and you can fill them out prior to your initial visit. At the initial visit, we will give you a tour of the office first and you'll get to meet some of the assistants that will be working with you. We have a patient in the chair right now, a new patient, and one of the first things we do also is take your blood pressure. So Elena's taking her blood pressure right now. We will also be doing a very thorough exam of your teeth and your gums and just assessing your mouth. So we'll start out with an oral cancer exam. Oral cancer is the 6th most common cancer. Very critical that dentists check very carefully for it. Sometimes it can be something as innocent as a little white spot, a little red spot, or a little bump or something that you're not even aware of. So very important that we do a real thorough exam. There are 2 parts to our oral cancer exam. One is the visual exam. The second is a machine that we have. It's called a belt scope. The belt scope is right here. I don't know if you can see that on there, but what this does is it produces a special type of beam of light that we will shine in the mouth and look through the filter, and it will show us if you have any areas of abnormality, any cancerous lesions or any precancerous lesions. So we will be doing the belt scope at your first visit too. Then we'll do a check for any cavities that you might have in your mouth, any cracks in your teeth, different things like that. We have what's called an intraoral camera. This is the camera right here. And it will take little pictures inside your mouth so that if there is something that is of concern, you will be able to actually see what I'm seeing. Much easier to be able to put a picture on a screen, so we use the intraoral camera. We also will be doing a real thorough check for gum disease. We'll be measuring your pocket depths, which is the space between the tooth and the gum, and just assessing your gum health. After we know exactly what the status of your gum tissue is, that will allow us to be able to determine what type of hygiene appointment to schedule you for. Some people just require a routine cleaning. Other people may require a little additional gum therapy. So after we have that assessment, we can optimize your time and make sure that our hygienist has the appropriate amount of time to do exactly what you need to get your mouth healthy. A few other things we'll be checking. We'll be checking your temporomandibular joint, make sure that your teeth are aligning properly, that you're not having any problems with that. We will be, what else will we be doing? We'll be looking for things like recession, loose teeth, any concerns that you might have as far as mouth odors, different things that we can address like that. If you have any cosmetic issues, you're thinking about bleaching or doing veneers, you want to change your smile, we can talk about all of the your cosmetic concerns. We also will be taking a full set of x-rays. If you have not had a full set of x-rays within the last 3 years, then we will be taking those. Our assistants take the x-rays. We do digital x-rays, so they will be downloaded into the computer. We'll be able to put them on the screen and you will be able to see them too. Mainly this is a fact-finding appointment and a get-to-know-you appointment. We want to know exactly what you have going on in your mouth, and we want you to know what's going on in your mouth. So that appointment takes about an hour from start to finish to get everything done. Like I said, a lot of information is gathered and a good time to get to know you and just what your needs are. So we hope that you'll be coming in to see us, and we'll look forward to seeing you. Thank you for your time.